Q. What exactly is apetamin syrup? A. Apetamin is a syrup that combines cyproheptadine, L-lysine, and vitamins. Together, these ingredients stimulate appetite, improve protein utilization, and correct minor vitamin deficiencies. Q. What does each 5 milliliters of apetamin contain? A. It has 2 milligrams of cyproheptadine, 150 milligrams of L-lysine, 2 milligrams of thiamine, 1 milligram of pyridoxine, 15 milligrams of nicotinamide, and 4.5 milligrams of dexpanthenol, along with a colorant called sunset yellow. Each of these plays a role in appetite stimulation, metabolism, and overall nutrition. Q. How does apetamin help with appetite? A. Cyproheptadine works as an antihistamine with appetite-stimulating effects, while lysine, an essential amino acid, supports protein synthesis. Combined with water-soluble vitamins that act as coenzymes, the body absorbs and uses lysine more efficiently. Q. How is cyproheptadine processed in the body? A. After being absorbed in the gut, it's metabolized in the liver and excreted mainly through urine, with some in feces. This explains why its effects are fairly quick but don't last too long. Q. How quickly does apetamin start working? A. It usually begins to take effect within 15 to 20 minutes of taking it orally. That's because cyproheptadine acts rapidly after absorption. Q. When is apetamin recommended? A. It's given for loss of appetite, poor eating habits, anorexia after illness, or during recovery from surgery or major sickness. It basically helps patients regain nutritional balance when eating is difficult. Q. Who should avoid taking apetamin? A. It shouldn't be taken alongside other antihistamines or sedatives, since combining them increases the risk of drowsiness and dangerous CNS effects. Q. What happens if someone overdoses on apetamin? A. Symptoms can range from drowsiness and dizziness to hallucinations, dilated pupils, dry mouth, and stomach upset, especially in children. If untreated, it can even cause convulsions. What should be done in case of overdose? A. If vomiting doesn't happen naturally, it should be induced using syrup of ipecac. If that fails, gastric lavage with saline followed by activated charcoal is performed, while ensuring the airway is protected, especially in kids. Q. Can apetamin be taken during pregnancy or while breastfeeding? A. Its safety in pregnancy and lactation has not been established, so doctors generally avoid prescribing it during these periods unless absolutely necessary. Q. Why is apetamin risky for children? A. Children, especially infants, are highly sensitive to antihistamines. Overdose can trigger hallucinations, severe drowsiness, convulsions, or even central nervous system depression. That's why dosing must be strictly controlled. Q. Does apetamin affect mental alertness? A. Yes, it can reduce mental sharpness. This means patients should avoid tasks that require focus, like driving or operating machines. In young children, instead of drowsiness, it can sometimes cause hyperactivity or unusual excitement. Q. How does it interact with alcohol or sedatives? A. Apetamin can intensify the effects of alcohol, sleeping pills, tranquilizers, and anti-anxiety drugs. This happens because cyproheptadine has additive sedative effects, which can dangerously slow down brain and body functions. Q. Is apetamin more dangerous for older adults? A. Yes. Elderly patients are more likely to experience dizziness, low blood pressure, and sedation because their nervous systems are more sensitive to antihistamines. Q. What side effects should patients expect? A. Common effects include drowsiness, dizziness, lack of coordination, and deep sleep. Interestingly, these symptoms often lessen after a few days as the body adjusts. Starting with a low dose helps minimize discomfort. Q. How safe is apetamin overall? A. It's considered safe for both children and adults when used in proper doses, but close caution is needed if other sedatives or CNS depressants are involved. Q. What's the recommended dose for children? A. Children aged 2 to 6 years should take 5 milliliters 2 to 3 times daily before meals, while those 7 to 14 years take 10 milliliters at the same frequency. Q. What about adults? A. Adults are prescribed 10 milliliters 3 times daily before meals. This regular dosing ensures steady appetite stimulation and nutrient utilization. Q. How is apetamin packaged? A. It's supplied in 200 milliliters amber bottles packed in individual cartons. The amber glass protects the syrup from light damage. Q. How should it be stored? A. It must be kept below 30 degrees Celsius, away from direct sunlight, and always out of children's reach to avoid accidental ingestion.